Welcome to Mythbusters, which for us at PANK is just our edition of answering a lot of questions and common misconceptions that we hear or that we see when we're seeing patients and families here at the office. Today's topic is constipation, specifically the myth that follows. I poop daily, so I am not constipated. We hear this all of the time, and we're gonna talk about why that is not true, or usually not true. So first and foremost, when we talk about constipation in the office, yes, we care about how frequently someone has a bowel movement, but other signs of constipation can include things like straining or pushing hard to poop, having pain when we try to poop, or having what we call ball-like stools, which sometimes look like little nuggets, or we might call them rabbit or pellet poops. Or if anyone is having, any blood when they wipe, or blood that surrounds or coats poop. Those are all things that would say to us we're constipated, even if that stool is coming out daily. Our general goal for kids is for them to have at least one soft, easily passed stool daily, ideally, or maybe every other day if they're meeting these other criteria. To achieve those goals, we can do things related to diet. It would be things like making sure that we're staying nice and hydrated, making sure that we're getting fiber with that hydration, making sure we're not doing a ton of milk, and my kids who maybe overdrink milk and cause constipation that way. Those are kinds of things that we would look out for that may help address constipation. And as far as our medications, probably the things you see us use the most would be things like Miralax, Senna, or a suppository. Often we'll start with Miralax, especially in our older kids. If they're kind of young, sometimes we'll do prune juice, which is more of a dietary thing, kind of in place of Miralax to help get stools running. If we're doing daily Miralax and not getting to our goal, you may see us add something like Senna, or if we feel like stools have gotten to a point that someone is extremely uncomfortable, or we're pushing around on their belly during their exam and we're feeling a lot of stool hanging out in the colon, and we think that's the cause of discomfort. And sometimes what you'll see us do is what we call clean out, which is when we do higher doses of Miralax and Senna to soften stool with the Miralax and to push stool forward with the Senna, and basically try to get as much stool out of the colon as possible. Kind of similar to what adults might do when they have a colonoscopy. Not quite as severe, but it gives you the idea. And often once we do that and can get some relief, we talk about what we can do moving forward to avoid similar things happening. So long story short, or our take-home points, signs of constipation include more than just how often you poop, and diet modifications as well as regular medications from over the counter can be used to help manage constipation. Finally, treating constipation can help prevent constipation-related complications, things like trouble potty training or UTIs, which we had discussed previously, but which is one of the reasons we care so much about stools, and you hear us ask about it all the time. Thanks, bye.